A very warm welcome to all of you to this ICH for Patient webinar, Living with an MPN, a Dialogue with Patient. So I'm Mohamed Moti from the Sorbonne University and Saint-Antoine Hospital in Paris in France. It is 7 p.m. in Paris, 7 p.m. in Marseille, and I would like to welcome you all to this special edition of the ICH Patient for series. Today, we are very honored and privileged to host an open and heartfelt roundtable dedicated to living with a myeloproliferative neoplasm. And thanks to the two patients who kindly and bravely accepted to join us, this session will be all about listening, sharing, and connecting. You will hear directly from two patients who have lived and are living with MPNs. Their voices, experiences, and resilience are at the heart of this conversation. And together today, for the next 30 minutes, 40 minutes or so, we aim to shed some light not only on the disease, but also on the lived realities, challenges, and hopes that come with it. So whether you are a patient, a caregiver, a patient advocate, or a member of the medical community, I do thank you for joining us and for being part of this dialogue. So let's begin, and I'll start with you, Mrs. Maya Abrahamian. Bonsoir.
Bonsoir.
Can you please share with us, briefly introduce yourself and share with us a little bit about your MPN journey, how and when, whatever you like to share with us.
Yeah,
And
of
then I'll
course.
go to Philippe and you'll introduce yourself. Ladies first.
Thank you so much. So I'm very honored to be here today, taking part of this webinar. So Maya Abrahamian, I'm French and German. My MPN journey officially started nearly 4.5 years ago, when I was lastly diagnosed to essential thrombocythemia, but I had high platelets at least 10 years before. So it was somehow, okay, I'm happy to know lastly what I have, but it was a very bizarre thing, because I was diagnosed it was during COVID time, Corona, and it was on a video call with a hematologist I did not worked with before, because I went for 1.5 years to Germany, where I were very happy with a MPN specialist in Berlin. And when I moved to the south of France, lastly, I had the reflex to get a hematologist who is aware of all these special diseases, because it's it's a rare disease. And I had this. I was a little bit, no, I cannot say angry, but I would have known before all the risks I could have taken during 10 years because of my high platelets. And never my physicians nor anybody did say, as well in France or in Germany, because I lived on the border and I saw physicians on the both sides, did not take care of it. Well, I was really lucky, because I had no stroke, not anything, but some small things which were bizarre. I had, of course, fatigue. I had some scratching sometimes, but it went away. I had some winter, very cold, and very lot of bizarre. And the most bizarre was a migraine with aura. And when I was diagnosed, and during this day, the 5th of December, I asked the hematologist, "Is this migraine with aura? Is it something related to my essential thrombocythemia?" And he said no. And then I start getting reading. I think of everybody on internet. I'm sorry, my mother's calling. Sorry.
So you tried to consult with Dr. Google on the internet.
Yeah, Dr. Google. And so then I became aware, and I wanted to empower myself. And just making the things short, I I read the book of Karine Tourmente-Leroux, who create a patient organization, and I joined this patient organization, and I'm also now a referee for the Bouches-du-Rhône, which is a department in the south of France for these diseases. And I see that's how important it is to empower patients, how important it is to share about our MPN journeys together and just do the best of it. Because you have to live with it all your life. Actually, maybe I hope it will change one day.
Thank you very much. This is very emotional. So, Mr. Philippe Cheng, please introduce yourself and tell us a little bit about your MPN journey.
Okay, thank you very much. In fact, I'm a retired physician. I was trained as a cardiologist, and now I'm a full-time patient, I'm saying. Um, in fact, I was diagnosed 25 years ago with PV, polycythemia vera, by chance. It was just a blood check asked for insurance company, and they said that there was something wrong with my blood count. Um, and I saw a friend of mine in Lariboisière, which is one of the leading hospitals in Paris, who said, "Well, it's not so serious. We can just check your blood count on a regular basis, take some blood away from time to time if necessary." And I didn't complain of anything. I had no symptoms, nothing. I had a very active professional life. I flew to the US and back to Europe at least once a month, not suffering of anything. Yeah? And at Lariboisière, they asked me if I could agree to participate, and this is a very important point to know, to a clinical trial, which was, I guess, one of the first with the interferon Pegasus in treating PV. That's back in, I don't remember exactly, probably 2004, something like that.
Yeah, indeed. Interferon alpha, the
Yeah,
classical historical
yeah,
form of standard interferon alpha.
exactly. However, it was a disaster for me because I suffered from a lot of side effects. In fact, I suffered, while I didn't suffer from the disease itself, I suffered from significant side effects. Uh, I had some, say, depression, mental issues. My wife said, "Well, we will divorce if you if you stay on drug," because I was not myself, I would say, in short. And I had to stop the medication. I took hydroxycarbamide, Hydrea, for 20 years without any side effect until it didn't work anymore. So the hematocrit was rising up. no symptoms, no signs from the disease, but the blood count was not okay. Let me tell you that in 2004, I also had acute thrombosis when I was in Berlin for my for a professional meeting. I had terrible pain in the gut, in the body, and blood in the digestive tract. So when I went back to France, they said, "Well, it's ischemia mesenteric." So it was quite serious, and so that's the reason why they decided to put me on Idrea. And increasing the doses up to 4 pills a day with aspirin, obviously. And 1 year ago, so my hematologist decided to put me on Jakavi. Well, I was a little bit reluctant, as although I'm a physician and
So Jakavi, just to remind everybody, this is
yeah.
ruxolitinib, a JAK2 inhibitor.
Thank you. That's it. Um, I was a little bit reluctant because I was so familiar. Idrea was so familiar to me, moving to a new drug, which was quite recent. And in fact, I had some minor issues starting with the drug. You know, digestive discomfort, something like that, fatigue, some weight gain. However, the hematocrit now is in the correct range. So I mainly suffer from fatigue, like Maya. I don't know whether it's the age. I'm 67 now, or if it's related to the disease or the drug, and that's it.
Thank you for sharing this journey. So my question to you now, Maya, and then I'll come back to Philippe, is the impact of the symptoms of the disease on daily life. Because the tricky part of this MPN story is that from a medical perspective, and this is what exactly Philippe alluded to when he was diagnosed, he was told, oh, this is benign, this is not life-threatening. Everything is going to be fine. However, we know today very well, and this is part of the goals of your patient advocacy group, Vivre avec une NMP, is to raise awareness that this is not so benign as it appears. There are the symptoms, you have the side effects of the different drugs, whether hydroxyurea, whether ruxolitinib, whether aspirin and its complication, and so on. So for you on your daily life, what is the impact of these symptoms, and what can you share with other patients living with this condition, or maybe what you would like to tell physicians to take into account, about this?
Yeah, I think, well, I think I'm a very lucky person because, well, as I said, well, I will become 55 in next month, but I'm quasi retired, because, well, it's a choice of life and a possibility. And so my fatigue is quite less when I used to work. I used to travel a lot. And then, of course, I had terrible fatigue compared to other people of my age. I had to go to bed at 9 o'clock. I had no energy in the evening. It was really terrible. I did not know that it was because of my disease concerning myself. And as a referee for MPN, a patient expert, I have the possibility to discuss with a lot of other patients. And fatigue is, I think, one of the most important things. And it's not so benign, of course, because you have brain confusion. On my side, I have much difficulties for concentration, you know. When I learned for my diploma, it was terrible to learn something by heart. I have quite difficulties with that. Maybe it's because of my MPN. Maybe it's because I'm in the special woman age. You know what I mean? And I don't know, but of course, I can remember a very interesting discussion with MPN person I met on a international conference, and this guy had, well, he had myelofibrosis, which is okay, not very nice, but he had bone marrow transplants, and since then he said, I have no fatigue anymore. And this is, well, I don't, for, you know, for many reasons, it's of course not the thing everyone wants to have a bone marrow transplant because it's something hard.
Yeah,
But
definitely we will not offer bone marrow transplant just to
yeah,
treat fatigue.
of course.
Mm.
But this thing, just one day, if we could have something, some medication, just get a magic, something, and say, I don't have fatigue anymore. I'm back again. This would be so nice. I only take aspirin right now, but it might change. At least at 60 years old, it's how the therapy is here in France, at least.
So clearly, fatigue is an issue, and this is really a very challenging symptom because many diseases come with fatigue, and this is something very hard to handle. So, Philippe, your story is also very interesting because you started your disease when you were, I would say, in the middle of your active career. And so, what was the impact of the disease and the symptoms on your day-to-day activities, your professional commitments, and so on?
Well, it's a key question, huh? But the answer is not simple, huh? Let me tell you a story. 2 months ago, I had a lunch with my former boss, who is retired. And during the lunch, I said, "Well, do you know that I suffered from MPN, polycythemia vera?" And he looked at me as, he said, "Well, I didn't know that." So people don't know that you suffer. It's invisible disease, huh?
Mhm.
Um, at the what we say, médecine du travail, so there is a special service when in the big companies you can see a doctor who is related to your company, and they never noticed anything wrong. Huh? Well, I had, a little bit of hypertension, a little bit of cholesterol, but nothing more than that.
They always declared you're fit for work.
Yeah, exactly. Yeah. So until the end, until just before the COVID, I suffered from a very severe burnout. I had to go in psychiatric disease for 3 months. I had two full-time job at that time. I was very involved in my company, but also in a professional organization. I was elected the chairman of this organization. So it was really a two full-time job. And at some point, my body said, or my brain said, well, stop. And maybe my disease, was, well, when I did discuss with the psychiatrist, he said, well, your blood disease is not is probably part of what happens to you now. Um, but apart from that, I didn't suffer from any classical symptoms from PV. Never had itching, and never had anything related to PV. But I guess that my fatigue is mostly related to the treatment. That's my feeling.
Thank you very much. So you alluded to, well, first of all, this invisible part of the story, and obviously, this is quite difficult because the environment would consider you as, fully active, fully fit, and then sometimes you go through these bad moments. So I guess it's not only about physical symptoms, but also the emotional and mental health. So maybe Maya, what is your experience emotionally living with a sort of a chronic disease? Although you nicely mentioned that your treatment is very mild, only aspirin, and you're coping quite well with it. So, anything you can share with us?
Yeah, sometimes I think I do a little bit like you say Autriche. Yeah,
You cheat?
my head in the sand. Well, of course, it's not easy to know you have a cancer, and you have a cancer, a chronic cancer, all your life, and you have to cope with it. At least this world it can be a chance because of when it was like no, it became a cancer in 2008. It opened a possibility to get funds for research. So in this sense, it's a chance for myself knowing I have a cancer. So shit, I'd like to not to have it, of course. But I am quite positive because on the other side, my husband has prostata cancer, and few weeks after my diagnosis, and this was something completely different for me. So, well, I'm happy with what I have, you know.
So, can I, Philippe, can I ask you now about the relationship with your hematologist and the other healthcare professionals? How how do you feel your voice is being heard during the consultations? Is there anything you would like to convey today to the medical community based on your 25 years plus experience with this disease?
I hope he's not listening to us, huh?
Well, the problem is that it will be broadcasted, put
So,
on now it's broadcasted live and it will be put on demand. Everybody can access it.
okay. Well, it doesn't matter. So I really have a strong confidence in my hematologist. Well, he's quite difficult to reach, huh? So anytime I have something which I feel it's not normal, I can send an email to his secretary, and she will reach to him. So this is the way we interact outside of the formal consultation. But this is quite important to know that if there is something wrong, I can reach to him. Um, well, usually we discuss a lot of many things. For example, I'm half Chinese, and he loves to travel to China, to Asia. So I did last time I saw him. I no, it was not last time, but once I told him about the trip I made in Taiwan, 2 weeks with my 4 kids. It was an incredible trip, and he was looking at me saying, "Wow, I would like to do that." And this is something important because, well, we have something in common in addition to the disease. Huh? However, it happened to me last time. Um, Whenever he's very stressed because too many patients at the waiting for the consultation, or he had to deal with some very bad issues with a patient. he considers that I'm a very simple and straightforward patient. So for me, last time he saw me in the office, he sat, took the script sheet and said, "Well, do you need a refill?" I said, "Well, first we should have a look at my blood count." So he was, I was for him. I'm a very simple patient and straightforward, and so because of this special relationship that we have together, I can stop him and say, "Well, hey, listen to me, 1 second."
Excellent. Well, at least as far as I'm concerned, I can really confirm that I've visited Taiwan several times, and it's quite amazing whether Taipei, the heartbeat of Taiwan, Taipei 101, the National Palace Museum with its immense collection of Chinese art and artifacts, the night markets, the local
Yeah,
eats, the hike of the Elephant Mountain for epic views, and
Wow.
beyond the capital, Toroko Gorge, the Sun
yeah,
Lake,
Sun
Alishan,
Lake, yeah.
Ilio Geopark, Jiufen, Tainan, Penhu,
So,
Kinting, Hot Springs Waterfall. It's amazing. So I agree that.
so we share this together. It's incredible. But this is something I wanted to tell you. Before planning the trip with my kids, well, they're not children, they're adults now. Sometimes I said, well, I should better leave them together. I'm too old, I'm too sick, I'm too whatever. What if I make a thrombosis in the middle of nowhere in Taiwan, and so on and so forth? And finally, I said, well, let's go. And everything went well.
Well done. Maya, what about you? When it comes to your relationship with your physician and how was the communication? What's
Um,
your advice?
I am very, very lucky as well as when I had a physician at the Charity in Berlin. He was great. He took time. And now, since 3 years, I'm here in Marseille with a hematologist, which is great. When I have a question, I send him an email. He answers very quickly. Sometimes he gives me a call. He's just incredible, and I think as well as Philippe and I have a feeling we are very lucky, but because I have. Maybe it's not the same with each other patient. We have I have a very good confidence in this man, and he's an human, yeah.
But thanks to your testimony today, I think other patients can go back to their physician and say, well, maybe I want this and this. So both of you are extremely active in the national MPN advocacy group. And can you tell us, Philippe, how do you believe patient empowerment and education, why is it important, and what how how do you view your active role to help other patients?
Well, in our group, in our advocacy group, I'm in charge of public relations, mainly relations with institutional bodies, with the government and the parliament, and so on and so forth. And Karine, our president, created the so-called Septembre Rouge, Red September, which is an incredibly stuff where she received the blessing of the Ministry of Health this year, which was not taken for granted. Huh?
Absolutely, and I would like to emphasize that Mrs. Karine Tourmente, who is the president of Vivre avec une MNP, has kindly delivered a webinar in French a few weeks ago, and she's extremely active.
Yeah.
And We at the ICH are extremely proud actually to be partner of this Red September awareness about red blood, about blood diseases, and we'll do our best to push this to help patients. So yeah.
And you know, it's done by all the members of the patient advocacy in the regions, in the territories, wherever in France, in Normandy, in Brittany, in the south, in the west, and people are very motivated to participate. But it's not easy. Yeah? You have to spend a lot of energy to talk to people, to mayors, to people who are elected, to decision makers, and to convince that they have to be part of it.
No, and they are all volunteers. Maya, any thoughts on patient empowerment and education?
Yeah, of course. Yes. Well, I had the possibility to get kind of education at somehow Université des Patients to help other people in education, to help other to get well on their journey and to get empowered. I think patient education is the most important. It's a basis because if you don't have it at the beginning, during the journey, during all the time of a journey, you may depends, of course, of your character, but if you have to be informed, you want to exchange with other people about your disease. You just it could be on other topics, but I think this is very important today to get your own master of your disease, and you decide what is best for you. Of course, we're in working hand together with your hematologist and the other medical person who could be on your journey. Yeah, I think I don't know if I was clear about.
And there are special trainings because you need some training. And Maya is undergoing a special university degree on that. And next end of this month, I will be in Rome for a weekend patient advocacy training for cancer patients. And I think I look forward to that because I think it's very helpful.
I did this training last year and it was absolutely fantastic. Yeah, it's a big chance. Yeah.
This is really fascinating. And as we come to the end of today's highly inspiring roundtable, I would like to sincerely thank each of you and, of course, the participants and all patients, wherever they are, for sharing their stories, questions, and reflections. I think your voices remind us that beyond the science and treatments and scientific advances, it is the lived experience that truly shapes how we care, how we connect, and how we can move forward together. We at the International Academy for Clinical Hematology, we remain deeply committed to supporting patients and families through education, advocacy, and continued dialogue like today. So let's keep this conversation going and never forget, you're not alone in this journey. Thank you, Philippe. Thank you, Maya, for being with us today. Thanks to the whole audience. Stay strong, stay informed, and stay connected. This is the ICH across the hematology field and around the globe. Take care.
Thank you.
Thank you.